Hello, a warm welcome to everyone. Thank you all for taking the time to join us this evening. This is our second webinar. We had our first one last month. And this is recorded. So if you weren't unable to join us last month, all our presentations will be available on the CVS Equine YouTube channel. So this talk should be available in the next couple of days. So just to introduce myself, my name is Amy. I'm one of the vets at Scott Dunn's. Some of you might have seen me out and about. I'll be your host for this evening. And our speaker is Chloe. Chloe is going to speak to us a bit about equine Cushing's disease, or PPID, a topic that I'm sure a lot of people have some experience with in one form or another. So it will be interactive, so we will be asking questions, and there's polls and stuff to get you to answer. If you have any questions, please do use the Q&A button at the bottom and just submit your questions, and I will put them to Chloe at the end of the talk. So, and hopefully everyone will be able to take away some useful information from today, and we'll be able to answer any questions you have. So without further ado, I'll pass you over to Chloe, and we'll get started.
Thank you, Amy. So there's a few names that I recognise on the participant list, but for those of you that haven't met me, my name's Chloe. I've been at Scott Dunn's just under a year, having relocated with my husband from Essex to Berkshire. And I'm a bit of an internal medicine geek, so Cushing's disease and laminitis is something that I feel quite passionate about, both in terms of welfare when it comes to laminitis, but also out of personal interest. And it's had a lot of research over the last decade, so I hope I'm going to be able to fill you in with lots of new information. So without further ado, so we've got a few topics for discussion this evening. The first is going through exactly what Cushing's disease, or PPID, is. I think we all know or associate Cushing's with a little hairy friend like the one at the bottom, but hopefully we'll assess there's lots more clinical signs to look out for, as well as our little curly-coated friend. So how we recognise PPID through those clinical signs, how we diagnose it with various tests that we can do, and then why it does cause laminitis. Just a little hoof there with some laminitic rings around the base of it, how we treat it, and then the reason really whilst we're all here, how can we minimise the risk of a horse developing laminitis with PPID? The last thing we want is a horse with a foot x-ray like this, where we've got rotation of the pedal bone, chronic changes like lipping of the pedal bone here, and a pedal bone that's very close to the sole of the foot and potentially coming through. That's what we're trying to avoid. So just to confuse everybody, we sometimes call it equine Cushing's disease, and we sometimes call it PPID. So PPID stands for pituitary pars intermedia dysfunction. So it's a disease that's based within the pituitary gland, and within a very specific part of that pituitary gland called the pars intermedia. Cushing's actually refers to a human disease that was identified by Mr. Cushing, and although it is also associated with the pituitary gland, it's actually from a different part of the pituitary gland, so there's a different disease process going on. So I'm going to refer to it as PPID throughout the rest of this talk. Obviously, lots of people know it as equine Cushing's disease, which is fine, but just for this evening, let's just think of it as PPID. So I'm going to start off with a little poll. Just want to see how many people here own or care for a horse or pony with PPID. So a couple of answers there. Yes, I own or care for a horse or pony with PPID, or no, I don't own or care for a horse or pony with PPID. And then if we can just share those results. Okay, brilliant. So about 80% of you own or care for a horse with PPID at the moment. That's great. Thank you, Lou. And then, sorry. how many of you have seen a case of laminitis associated with PPID? So yes, I have seen a case of laminitis associated with PPID, or no, I haven't. Let's get the results today. So about 60% of you have seen a case of laminitis associated with PPID. So that's great. Looks like we're reaching our target audience, which is brilliant. So we will move on. So what exactly is PPID? So this structure here is the pituitary gland. This is a cross section through the pituitary gland and then looking at it through a microscope. And you can see that it's divided into a few different regions. And the pars intermedia, which is the bit that is associated with PPID, is this very narrow band of tissue running right round the edge here. Okay. And that pars intermedia produces several different hormones, and that hormone production is fairly closely regulated. So if the body senses that too much hormone is being produced, dopamine is released from the hypothalamus to stop the production. And if the body senses that not enough hormone is being produced, then thyrotropin releasing hormone is released to stimulate the production of the hormone. But what happens in PPID is, at the moment, what we think is happening is that age causes degeneration of the neurons that transmit the dopamine, which means that we lose that negative feedback control. And that loss of dopamine inhibition just leads to massive production of hormones from that pars intermedia and enlargement of it as a consequence. And I'm going to apologise now for my dogs barking in the background. My husband is obviously not doing a good enough job of keeping them under control, but hope you can all still hear me fine. So this is a couple of images of a pituitary gland of horses with PPID. So in this top image, you can see the pars intermedia here is more enlarged. The pars nervosa in the middle has been slightly squished. And we've also got these structures called microadenomas within the pars intermedia, which is basically just more pars intermedia tissue going on within that. So all of these microadenomas are producing lots and lots of hormone. And then in this bottom picture, this is a slightly more advanced case. So you can see that that pars nervosa has basically almost been completely obliterated. The pituitary gland has been almost completely overtaken by the pars intermedia, with a big adenoma in the middle here. So this is going to be producing a phenomenal amount of hormones. So all of those hormones produce a variety of clinical signs. So we've got the excessive curly coat, our little friend again, that I think we're all fairly familiar with. We also see weight loss or muscle loss, which you sort of associate with the pot belly, or maybe a loss of top line. Excessive drinking and urination. You may not notice your horse drinking that much, but I'm sure you will notice when your horse's bed is even wetter than usual and you've got more urine to muck out. Recurrent infections, classically sinusitis, like this nice snotty nose here, or recurrent foot abscesses. Horses can become quite depressed with it. You can have bulging supraorbital fat pads. So this is a case of ours here, and she's got a lovely fat pad bulging above her eye socket here. Changes in mentational behaviour, sweating abnormalities, classically patchy sweating over the shoulders and other various places. Reduced fertility, you might notice if you've got a broodmare or something, all of a sudden she's not getting in foal when she's usually quite reliable. And of course, the big one, laminitis. This is the one that we really worry about as vets, because a lot of these other clinical signs you can manage fairly well. If your horse has got a long curly coat, you can clip them out. If they're drinking too much, you just provide them with more water. But laminitis is the one that as vets we really worry about. So how do we go on to diagnose PPID? So the first thing we're going to look at is a hormone called ACTH. So ACTH is one of the hormones produced by the pars intermedia, and luckily it's one that we can fairly easily measure as well. So those levels of ACTH will naturally vary during the day, so it's really helpful, especially from a monitoring perspective, if you try and arrange your blood sampling at the same time every day. It does need to be chilled quite quickly and get to the lab fairly quickly, so we try and avoid doing these blood samples on a Friday afternoon. We don't want this blood sample sitting in the post over the weekend and giving us a false result. Stress and pain can influence the result as well. So I tend to not do these blood samples the first time I go see a horse with really bad laminitis. I like to wait until their pain is under control, and then go back and do those blood samples later once they're a bit more comfortable. And there is quite a lot of seasonal variability as well. And this is something that's been researched a lot recently. So this paper actually dates back to 2014 and it's already out of date. That's how much research has been done. But you can see here the black columns show normal horses and the grey columns show horses with PPID. And you can see that in autumn time, August, September, October, normal horses will have a slight increase in their level of ACTH, whereas PPID horses will have a pretty large increase in their level of ACTH. So this makes it a really good time of year to test your baseline ACTH levels because the test becomes a little bit more sensitive. And B, the labs have been really good at adjusting their normal reference ranges to accommodate for that seasonal variation. And there are some labs now that even have changing reference levels per week, not just, you know, adjusting it month by month, but actually week by week, they will adjust their normal reference ranges as well. Now, sometimes we can be highly suspicious that a horse has got PPID, but our ACTH comes back normal. And in those cases, we will go on to do a TRH stimulation test. So if you remember, TRH is the hormone that stimulates the pars intermedia to produce hormones. And this is a much more sensitive test. So what we do is we take a baseline ACTH, we give them an injection of the TRH, and then take another baseline ACTH 10 minutes after that. This isn't a test that we tend to do as first line because the TRH requires ordering in on a special license. So we have to have good reason for administering this to a horse. And this graph shows nicely, so we've got our baseline ACTH here in a normal and a PPID horse, the normal horse at the bottom, the PPID horse at the top, and you can see that those two levels are fairly similar. In a normal horse, you'll have a slight increase after your TRH, and then it will come back down to normal. And then in your PPID horse, you'll have a massive increase in your ACTH. And there's certainly a couple of people here this evening who we've done that test on fairly recently. So another quick poll for you before we move on to the next part of the talk. Why do you think PPID causes laminitis? Is it because PPID causes an excessive amount of steroid, which causes laminitis? Is it because PPID is seen in fat little ponies who have an increased risk of laminitis? Is it because PPID causes increased insulin levels, which causes laminitis? Or is it because PPID causes equine metabolic syndrome, or EMS, which causes laminitis? Just wait for those results to come in. Oh, you're very good. So 52% of you have got the correct answer, that PPID causes increased insulin levels, which cause laminitis. But I have to say, the rest of you aren't wrong in any way. It was very much thought until a few years ago that it was the excessive steroid production that caused laminitis. And as I'll go on to talk about a little bit later, EMS, fat ponies, also cause high insulin levels, which cause laminitis. So they all cause laminitis by the same route. Okay. The answer, I mean, in all honesty, we are still learning. Like I said, this is a topic that's undergoing a lot of research at the moment, and things have massively changed in the last decade. But what we do know without a shadow of a doubt is that high levels of insulin, hyperinsulinemia, causes laminitis. And we also know that PPID causes hyperinsulinemia. However, how PPID causes hyperinsulinemia is still not fully understood. So that's something that people are looking into at the moment. We know that not all horses with PPID will have high levels of insulin, which fits with that not all horses with PPID will have laminitis. But when we look at the laminae of horses who have PPID, if they've got normal levels of insulin, under the microscope, their laminae look normal. If they've got high levels of insulin, those laminae look abnormal. So we are 99.9999% sure that it is these high levels of insulin that causes the laminitis. But how does high levels of insulin cause laminitis? Well, again, this is something that we're still learning a lot about, but it is thought to be through a combination of different factors. There's a degree of disruption of blood. The way that the laminae metabolize glucose and the way that insulin receptors are distributed on the cells is quite different to other cells within the body. So there's definitely some sort of disruption with the glucose metabolism. There are definitely signs of secondary inflammation that's usually associated with hormones produced by fat cells as well. And then you get chronic changes within the structure of the laminae that just make them much more weaker. So here on the left-hand side, we've got normal laminae. And on the right-hand side, we've got laminae in horses with PPID. And what you can see is that these laminae on horses with PPID are very elongated and thinned, and you've got these short, stunty secondary lamellae. And if you think of the laminae holding that pedal bone within the foot, a bit like Velcro, all stuck together, interlocking structures stuck together, it's not hard to appreciate that these laminae are going to do a really poor job compared to these laminae. But what's really interesting about this photo is this horse at the top right here did not have clinical signs of laminitis. Even though those laminae are pretty abnormal, that horse didn't have clinical signs of laminitis. So do not forget those subclinical cases. So just moving on to how we treat and monitor PPID. There is a licensed product called Pergolide, or Presend, you'll probably know it as, to treat PPID. And this is a dopamine agonist, so it mimics that dopamine effect to inhibit the hormone production from the pars intermedia. This is a lifelong treatment. If your horse is diagnosed with PPID and you start treatment, you can stop it if you choose to, if your horse isn't tolerating it or you don't think it's making much difference. But as a condition, it's a progressive lifelong condition, a bit like arthritis, that requires lifelong treatment. The dose required for each pony, horse does vary, so we do like to regularly monitor how those ACTH levels are doing, making sure that we're on the correct dose for that individual, and make sure that as that disease progresses, we don't need to alter it. We do have some cases where we just can't seem to keep it under control with pharmacological intervention. And we think that may be because if you've got those large adenomas within the pars intermedia, just so much hormone is being produced, it's impossible to get it under control. And then there are a few cases, I think it's about 6% of cases will have a side effect where they become quite inappetent. And that is something that we see from time to time, certainly, and it's something that we always warn owners about, that may be the side effect that we see. Someone did ask a question earlier about what to do if your horse doesn't tolerate Presend, and I will answer that at the end if that's okay. So how do we monitor our PPID? Well, we as we've mentioned, we monitor those ACTH levels quite regularly. Don't forget about the natural variation in the day. If you can, try and book it in with your vet sort of at the same time every time you have it tested. That will help limit the natural variation. All the labs have got their reference ranges varied to accommodate that seasonal variation, but you may want to consider testing them in the autumn time when their levels are going to be higher, and then again in the springtime when their levels are going to be lower, to see if you need to adjust the medication at different times of year. Most importantly, we ask how the horse is doing. What are the clinical signs? If you're happy, we're happy as a general rule. If the ACTH is reading normal, but your horse has still got laminitis, then obviously our work isn't done. We haven't fixed the problem. So looking at all the clinical signs is really important. For those horses that have been diagnosed with the TRH stim test, there's not really any good data about what the best way of monitoring those horses is. So it's going to be through a combination of your clinical signs, and obviously your insulin levels are really important. So as we'll go on to discuss in a minute, actually monitoring those insulin levels is probably key with those cases. And then we will potentially periodically recheck, repeat that TRH stimulation test to see how the ACTH is getting on. For insulin, as we've just said, it's your insulin that's causing laminitis. So if you've got a case of PPID and you're at risk of laminitis, or you've had laminitis, we really need to know what those insulin levels are doing. And this used to be a fairly unpleasant procedure of having to starve your horse overnight to get your insulin levels. We don't have to do that anymore, which is brilliant. There was a paper out last year that has shown that this test is just as effective as starving. So no starving required. Order some Caro-Light syrup from a internet-based someone that used to just do books. And then you want to give 45 mils per 100 kilos 1 hour before your vet arrives. And that's really what nipples are doing. So how on earth do we manage a horse which has got PPID and laminitis? Well, every case is different, and it's a massive team effort. This is a team effort between you, the owner, probably your yard manager as well, your vet, your farrier, nutritionist, anyone else that's involved or wants to be involved. Everyone needs to communicate really well. As we've said, monitoring those insulin levels is going to be really important alongside your ACTH levels. And as I said before, if we can ideally do that in spring and autumn to account for that seasonal variability, that's the ideal scenario. Regular farrier, obviously very important with all laminitic cases. And your farrier may notice something that sort of suggests that the foot is not a particularly happy place, and they may want to have some x-rays taken to see what's going on within that foot. And don't forget about those subclinical cases. Think about those laminae and how abnormal they looked in a case of PPID where that horse didn't have laminitis. So quite often we'll x-ray feet who have absolutely no clinical signs of laminitis whatsoever, and you x-ray the feet and you've got rotation and other changes going on in there. So there are definitely cases of subclinical laminitis. We need to restrict our feeds which are high in non-structural carbohydrates. So these is your starches and your glucose. Ideally, you want to keep those feeds less than 10%. When it comes to insulin, sugar is your enemy. But a lot of our PPID cases are underweight. So we need to replenish those calories with other safe foods. Fat is a fairly safe calorie to give, as well as things like non-molasses sugar beet pulp and alfalfa and vegetable oil, and ensuring that your horse has got a really good, adequate supply of good quality protein. Most of the geriatric sort of mixes designed for veterans are pretty good. Those feed companies have got onto this pretty well. So read the back of the packets carefully, but most of the commercial feeds you buy for veteran horses in particular, will be sticking to these rules. There are a couple of extra medications that we may consider if we can't get those insulin levels under control, which you might have heard of. So metformin was used quite a lot a few years ago, thinking that, as in people, it increases insulin sensitivity. We now know that it doesn't really work like that in horses. Unfortunately, it's not particularly great. So it is something that we do still occasionally use, but maybe not so much anymore. And then we can also use a drug called levothyroxine, which is a thyroid hormone, just to give their metabolism a bit of a boost. Obviously, that's not going to be appropriate for horses that are underweight, but for horses where we're struggling to get the weight off, that can be really handy to get their weight off and help get their insulin levels down. So a question we get asked all the time is, how do I feed my horse when it's got laminitis and PPID? And again, really sorry, no one size fits all. This is going to be a team effort. Every case is different. But we are going to ask lots of questions. So what are your current ACTH and insulin levels? Has your farrier noticed any changes to the feet? What is your horse's current body condition score? Where are the fat pads? When you've got high insulin levels, you get very characteristic fat pads over the body, and they tend to be at the crest of the neck, behind the shoulder, and at the base of the tail. Does your horse have any other concurrent diseases that we need to keep an eye on or need to take into consideration? And what is your normal management routine? Some horses don't tolerate being in a stable at all. Other horses prefer being in a stable to out at grass. And obviously livery yard managements are very variable as well. But the good news is, as a general rule, like I said, sugar is your enemy, and that includes grass. Very sorry, but sugar is your enemy. Fat's a fairly safe calorie to give. You want to try and keep your non-structural carbohydrates to less than 10%. Read the back of the packet of the feed that you're giving, and they should have an NSC concentration on there. If not, most of the major feed companies have really good nutritionists on the end of a phone, and you can give them a ring and ask what the NSC content is. Soak your hay to try and leach out as much nutritional content as possible. Recent data shows that if you soak it for less than 2, you're probably not doing very much, but if you're soaking it for more than 6, you may not be getting any extra benefit from it. Just be careful in really hot, warm weather that if you're leaving it in there for more than 2 hours, it is likely to create quite a stagnant, nasty environment. So try not to leave it in the same pool of water for more than 2 hours. If you're aiming for weight loss, you want to try and feed 1.5% of your horse's body weight in kilos. And if you don't need to lose any weight, then you want to try and aim for 2% of weight loss. So if your horse isn't grazing just on hay in the stable, that equates to 7.5 kilos of hay for 1.5% of body weight, or 10 kilos of hay for 2% body weight for a 500 kilo horse. And that's your 24-hour ration period. So you weigh it out dry and then you soak it, and that is your 24-hour ration. But like I said, that doesn't account for your calories consumed grazing. So how much grass can you give your horses with PPID that have had a history of laminitis? Well, horses can consume, if they're grazing 15 hours a day, which is basically out 24/7, they can consume more than their 24-hour ration quite easily. And little greedy ponies can consume a whopping 1% of their body weight. If you're aiming for weight loss, that is nearly all of your 24-hour ration in just 3 hours. I think we all know how greedy ponies are, but even that statistic so simply restricting your time out of grass may not be effective. If you're only turning your little pony out for 4 hours a day, thinking, well, that's fine, they can't consume that much. Yes, they bloody well can. So Consider use of grazing muzzles, consider use of really bare paddocks, track systems, anything that you can do to limit the amount that your horse can consume. Then you want to assess your body condition score monthly. Not rocket science. If your horse is consuming too many calories, the weight's going to go up, and if they're not consuming enough, the weight's going to go down, and then you can adjust it as required. It's really easy to get hold of weigh tapes, and as long as you use them consistently at the same place every time, you can get a rough average of what your horse is doing, be it gaining weight or losing weight. And look out for those fat pads. If those fat pads are occurring at the crest of the neck, behind the shoulder, and at the base of the tail, you know that maybe your insulin levels are creeping up. I see a lot of PPID horses who are really ribby and look really thin, but have got those characteristic fat pads in those places. And to me, that always screams alarm bells that, okay, we're not overweight, but our insulin levels still may be out of control. And I just wanted to touch on how to body condition score, just in case anyone is a little bit confused, because there's lots of different areas to look at. So crest of the neck, we've talked about, shoulder pad, we've talked about, and base of the tail, we've talked about, but also how palpable are your ribs. Along the back, we don't want a rain gutter along the back. We sort of either want sort of a nice inverted V, if possible, or flat. And then got a lovely demonstration of that apple bottom here with that gutter running along. So we want to avoid that if possible. This image is taken from the British Horse Society website, and they've got some really good tips there on how to body conditions. I just wanted to talk about PPID versus EMS, because I think this is something that people get quite confused about, understandably. They are two separate conditions, but they cause laminitis through the same mechanism. So we've got a lovely little Cushingoid pony here. So hopefully, as you will know now, PPID is caused by excessive hormone production and enlargement of the pars intermedia in the pituitary gland. Generally seen in elderly horses and ponies. There may be some breed predisposition, but generally we see it in every breed. It is associated with laminitis, but also lots of other clinical signs, as we've discussed. We diagnose it by looking at ACTH levels, and we treat it with pergolide. Whereas EMS, is a syndrome, so is a syndrome of combination of different things of obesity, insulin dysregulation, i.e. high levels of insulin, and laminitis. There is definitely breed predisposition, good doers, native ponies in particular, but there is no age predisposition. Those little ponies of any age can develop this condition. And we diagnose it by looking at insulin levels, fat hormones, and also looking obviously at obesity and laminitis. There is a question whether it predisposes to those horses or ponies developing PPID later in life. It's thought that those constant high levels of insulin may cause a bit of oxidative damage to those neurons releasing dopamine, which predisposes PPID developing later on. And primarily it's treated by dietary management, but as I briefly mentioned before, we do sometimes add metformin and levothyroxine into the mix as well. Just a list of lots of papers that I've used. Some of these do have open access if you want to read any of them, like this consensus statement on equine metabolic syndrome. And just before we go on to questions, I just wanted to say that research is happening all the time. Things are changing all the time. Since I've graduated, things have changed massively. So make sure you ask your vet about all the latest publications and latest data. And then there are two really good websites called Talk About Laminitis and Care About Cushings that have a lot of really helpful information about laminitis, EMS, and Cushing's disease. If you go on to Care About Cushing's, you can get some free ACTH tests to diagnose your horse or pony with PPID. And then if you sign up to them, they offer help in terms of testing for monitoring levels as well. And you can get, I think, an annual code to see how your horse is doing. But thank you very much for listening. I hope that's answered some questions and hopefully alleviated some confusion about PPID or equine Cushing's. But please put your questions in the Q&A if you have anything further.
Great, thanks, Chloe. Yes, so we have had a few questions come in during the talk. So one question is, what is the difference between laminitis caused by PPID versus other forms of laminitis? You often hear of fit thoroughbreds developing laminitis and things like that. So just to clarify,
Sure.
What's the difference?
Sure. So 90% of the laminitic cases we see will be caused by endocrine problems, i.e. high levels of insulin, and that is either then divided up into PPID or EMS that we talked about. So effectively, for the majority of laminitics, PPID causes laminitis through the same mechanisms as other forms of laminitis. There are a couple of exceptions where you can also see laminitis through endotoxemia or systemic inflammatory response syndrome, like after colic surgery, retained fetal membranes, things that cause sort of toxic syndrome that will also cause laminitis, and also through concussive processes as well. Really interestingly, if you look at the laminae under the microscope of horses that have had laminitis through insulin dysregulation versus horses that have had laminitis through endotoxemia, those histological changes are completely different. The mechanisms of how it happens are completely different. But for 90% of the cases we see, it's through high levels of insulin, be it PPID or EMS.
Great. A few other ones that have just come in. My horse is 22 with no clinical signs of PPID. Should I get his ACTH levels tested anyway, just to check, or rather than wait for clinical signs to develop?
It's not a bad idea. And the nice thing about Care About Cushing's is that you can get that lab fee for free from monitoring. And at 22, it is highly likely that you might have PPID going on. So if your vet was there doing an annual vaccination or something, it would be very easy to ask them just to whip a quick blood sample as well to check for it. Prevention is better than cure at the end of the day when it comes to laminitis.
Yeah, definitely. And a few others. So what is the likelihood of my horse with PPID developing laminitis, and what percentage go on to get laminitis? I guess that's
a really good question
to say.
I wish I had the stats for that. The honest answer, I mean, the best way to answer that is to get your horse's insulin levels tested. If your horse has got PPID but your insulin levels are normal, then your risk is fairly minimal. If you've got PPID and your insulin levels are abnormal, then you know that you're at an increased risk.
Great. It's all about control of those levels, I guess.
Yeah.
And something you mentioned earlier about horses not tolerating percent, and if there's any alternative.
Yeah, so we definitely have quite a few horses or ponies that go completely off their food when you start the percent. So what I tend to do is I start them on a half dose every other day for about a week, and then go to a half dose every day for a week, then go to a half dose one day and then a full dose the next day for another week before getting them up to the full dose. And generally that really gradual approach to increasing the level of pergolide sorts out the majority of cases. There is the odd case where no matter what you try, they just won't tolerate it. And unfortunately, there is no alternative. There's sort of a few people that I know have tried Agnus castus, sort of a herbal supplement that may help. So you could certainly try that. But yeah, there are some horses that just won't tolerate it, and there's nothing you can do. It's really frustrating. There's nothing you can do.
And another question with regards to Presend is, how long does it take to work?
So we tend to recheck how things are getting on 4 weeks after starting treatment. And that tends, if you've done that really gradual starting of treatment, then I'll wait until you've had a month on the full dose and then check how things are getting on.
Great. Let me see what other ones have come in. So I think we touched on that. That was again referring to a horse with PPID. How quickly will signs develop of laminitis in a horse with PPID?
Yeah, it's all going to be down to those insulin levels. Not all horses with PPID will have laminitis, and not all horses with PPID and high levels of insulin will have clinical laminitis either. So it just requires really careful monitoring, and that how that pituitary gland progresses throughout the disease is again really variable as well. There's no sort of set course that as soon as the disease process starts, in 5 years, your pituitary gland is going to look like this, and in 8 years, it's going to look like this. It's a very individual thing.
And again, another one coming back to horses that won't eat Presend. Some people have reported their horses become very lethargic, and different ways of trying to give Presend, diluting it in some water, syringing it, trying to break it up, disguise it in different types of food. Is that recommended? I guess trying to get it into them is the main.
Yeah, any way that you can. Pouring out apple, pouring out carrot just to get it into them. Some horses will eat it straight in their feed. I had a great story the other day about owner who gave her pony a tablet and a half a day, and bearing in mind they're not the cheapest tablets either. Like, you know, she's spending a lot of money every month on Presend. Anyway, very sadly, the pony died, and she was clearing out the entire stable and basically found 6 months worth of tablets buried in a corner of bedding, and this little pony had been pretending to eat it and then burying it in its bedding. So yeah, they are sneaky little buggers occasionally. There is a paste form of pergolide, which is produced under special license. Really useful for the little minis. I don't know if anyone's ever tried splitting a Presend tablet. You can split it in half quite easily, but splitting it into quarters is a complete nightmare. And the paste is quite a good way of getting that into them. And equally, if you're really struggling to get tablets in, you could ask your vet to order a syringe of the paste in to see if that's a bit easier.
Great. Another one. So all tests on my pony come back in the grey area. He is on a low dose of Presend. Any suggestions? He has a quarter tablet twice daily. Otherwise, he stops eating. Yeah.
If they come back in the grey area, that's when I really look at the clinical signs. Because if everything else seems fine, then, and you've got grey area blood results, we would obviously talk about the risk of laminitis, but if clinically the horse is doing well, then I would tend to leave alone. This is when it really helps to test the horse at different times of the year. So, you know, you have that natural increase in the autumn time. So I definitely test it then. And then also try testing it in the spring as well to see how things are doing. And make sure you try and test at the same time every day as well, just to limit that variability from natural daily variations.
Great. So so another one, my pony has had PPID since she was 8. She's now 17, and we seem to get laminitis on and off. She also has EMS and a liver condition, so we have it all. But just to say, she is fine. We just manage to beat what we can. I guess that's a tricky one when you've got multiple different conditions going on at the same time. It's is trying to weigh up.
Yeah, and we see it itself, you know, with those elderly horses with arthritis as well, and you can't really limit their movement and turnout because you need to keep them moving. It's really difficult, and it's very much a balancing act, and taking that individual case into consideration, and taking that quality of life. How are they doing clinically? That would be the most important thing. But it sounds like you know what your ACTH is doing, you know what your insulin levels are doing, and you know what your liver is doing, and then it'll just be a case of keeping things in as happy a status quo as possible.
So another question that's come in regarding restrictive diets on an overweight pony or trying to get weight off. Should they be supplemented with a multivitamin?
Yes, if you're soaking your hay and then not getting a lot of grazing, then yes, please use a good quality vitamin and mineral balancer out there. Yeah, there's lots of them out there.
And I guess ideally you don't want to feed them, give them hard feed, but I guess a little bit of chopped.
Yeah, I mean, most of the balancers out there and most of the veteran mixes are sort of really good at keeping that non-structural carbohydrate and sugar content down, and sort of making it palatable in other ways. But read the back of the packet carefully. There's some foods that are laminitis approved that still have molasses in them, so please read the back of the packets carefully. But equally, most of the big feed companies have really good nutritionists on the end of the phone. They know what's in all of their products, and they're really helpful.
Yeah, there's loads of options on the market nowadays. So the questions are coming in thick and fast. So an old pony retaining his coat, having a thick coat all year round, is this always a sign of PPID, or can it be anything else, or just normal for an older pony? I guess it's probably worth getting them tested.
Yeah, definitely.
Any other clinical signs?
I think I'm right in saying that there isn't really any other condition that causes that change in coat shedding and that long curly coat. So if your horse has got that, it almost certainly does have PPID, but definitely worth checking for. Some of those little native breeds are really good at having that lovely thick double layer coat because that's what they've evolved to have. So it may be normal, in inverted commas, for that pony, but definitely worth checking.
Great. And then another question that's come in regarding horses that have well-controlled PPID. How safe is it this time of year for them to graze without a muzzle or have access to that nice spring grass?
Just check your insulin levels. Until you know what your insulin levels are doing, you don't really know what your real risk of laminitis is. Your ACTH can look normal and your insulin levels can be off the scale. So the only way of properly assessing your laminitis risk is to assess those insulin levels.
Yeah, and I think that applies to a lot of the questions that are coming in. Again, another one, someone has a horse that becomes quite stressed at when the bloods are being taken. Because of this, they only get tested once a year.
Mm-hmm.
How can stress affect the ACTH levels?
So as long as the stress isn't sort of, I guess, in the hours build up, if they're just needle phobic and for 10 minutes whilst the vet's taking the blood sample, they're a bit stressed, that won't affect your results too much. Absolutely sensible just to have it done once a year. Make sure it's at the same time every year and hopefully at the same time in the day as well, just to try and keep that consistency. And also keep a record of all of your results. So even if stress is playing a slight role in elevating those levels, you can see the trend year on year as to what's happening. And your clinical signs, that's going to be really key. I don't like treating a piece of paper I'm treating the horse that's in front of me.
And another good question, are these conditions genetic?
Oh, that's a really good question. EMS definitely has a genetic predisposition. We think the reason EMS is developed is because, especially in our native ponies, they're designed to live on a moorland with scrub, which has absolutely no nutritional value in it. And so they've evolutionary basically designed themselves to leach out every nutritional value they can from that scrubland. Then we've gone and given them grass designed for dairy cows, which has more sugar content than they could possibly wish for. So there definitely is a genetic element to EMS. With PPID, it seems to be more of an old age change within the pituitary gland and hypothalamus that causes PPID. But like I said before, there is some evidence to suggest that horses with EMS are more likely to develop PPID later on.
What else have we got? We have a question regarding does PPID affect the amount of exercise riding my pony can or should do? I guess that comes back to if you've got clinical signs, if there's active laminitis, if those symptoms are under control, then there should be no real reason.
No, I mean, if you've got a happy, healthy horse with PPID, feet are happy and no other disease, there's no reason why you should have to limit your exercise.
And a few more questions coming in regarding different types of feed. I guess there are a lot, the market's pretty flooded with different geriatric mixes and different suitable for laminitic suggestions. I guess if in doubt, you should just speak to your either nutritionist or your feed company.
Yeah, I don't want to get into trouble because we're not allowed to specifically advertise certain feed types. But all the feed companies do have really good nutritionists on hand. If you've got your vet there, show them your packet of feed and say, what do you think? You want to try and keep that non-structural carbohydrate level below 10% if you can. And yeah, I mean, there's so many out there. And like I say, most of the veteran old age mixes are fairly suitable, but read your back of the packets, talk to your nutritionist, take photos of the back of the packets and the ingredients list and send it through to your vet and go, what do you think?
And another question I get that's come in regarding trying to manage a PPID pony with dental disease that is trying to find a suitable feed. A pony is arthritic jaw who quids, so I steering away from your long fibers and sticking to more soft palatable feeds and just checking the sugar content, your molasses.
Yeah, and also, I mean, I assume if they've got dental disease and they're quidding, they may be on the leaner side. So if that's the case, then you may find that your insulin levels are normal and therefore you can be a bit more relaxed about getting that nutritional content into them. But yes, soft feed, avoid hay, probably not consuming that much grass if they're quidding a lot. So those really nice sort of soft grass replacements and adding glugs of vegetable oil and other oils and fats into your feed just to try and increase the calorie concentration.
And I guess as well, offering multiple little feeds throughout the day to replace the forage that they're not getting.
Yeah, there's loads of fibre replacers out there from various different feed companies, be it ready grass or grass nuts or whatever, and you know, assess your horse's feet, check your insulin levels, see what your risk is, but then feed appropriately. And with all of those elderly horses that have sort of other concurrent disease going on, be it dental disease or arthritis, or maybe intestinal disease, IBD, that kind of thing, it is always going to be a balancing act. And just monitoring how they're doing and adjusting lots of different things as necessary.
And then one more question that's come in regarding feeding. I guess it's that time-old question about hailage versus hay. Does hailage have too much sugar for laminitic ponies? I know some hailages are now marketed with the hoof-kind mark to say they are suitable for horses prone to laminitis, but I guess it's just that question: is it actually suitable?
Yes. Almost my worst nightmare is those cases of equine asthma or RAO, COPD alongside laminitis, because the right treatment for one is completely the wrong treatment for the other. So as a general rule, hailage has too high sugar content for laminitics. But there are those newly marketed hailages out there. And I think really you just need, if it's a commercialized bagged hailage, they will have a nutritional breakdown on the back of the packet stating exactly what's in it. So again, you want to keep your non-structural carbohydrate level as low as possible. And yeah, just read the back of the packet, see what it is.
I guess from any of those actually specifically marketed towards laminitics, they will be batch testing. Probably
yeah,
batch testing.
Yeah, and they'll be, in some ways, that sort of commercialized bagged formula. You know what's in it a lot more. There's a lot more variation between the hay that people make on their own farms and stuff. But do read the back of the packet, and there are various labs and companies that will test your hay or hailage to see exactly what's in it as well.
Great. I think that brings us to the end of our, we've one more. Someone has been told that they should avoid feeding feed with magnesium. Again, I guess it's a trace element. I don't know of any adverse effects of magnesium.
No, I don't know of any adverse effects on that one. No, I mean, obviously you don't want to give too much of anything, but equally there's a lot of magnesium-based calmers out there on the market that seem to do a reasonable job. So no, I'm not aware of anything specific with magnesium.
Okay.
Someone did email in earlier asking about a specific feed, and I won't get myself into trouble by naming that specific feed. I did a bit of a Google search before coming online this evening, and yes, it looks fine. So if that was you emailed in beforehand, it looks fine.
And a few more questions coming in regarding workload for a pony that's on low dose percent that does low level endurance. Should I have any concerns? I guess that again comes back.
As long as they're sound, yeah,
absolutely, and under control. No, I think that's it.
Brilliant. Thank you everyone for joining us. The talk will be put onto the YouTube channel in the coming days. So if you think of anyone that would benefit from watching it, then please share it amongst yourselves. And please let us know if there's any other topics that you would like us to cover in future webinars. And your feedback is always really appreciated, good or bad. We would love to know what you thought of this evening. Thank you.
I guess as well, when people log off, if they have any more questions, they can just email them to us at the clinic, or you can just give us a call.
Absolutely.
As well.
Yeah, please just email the clinic, and you can always put for attention of Chloe or Amy in the subject, and it will just get forwarded on to either of ourselves to answer as soon as we can.
Great. Well, I think that's it. Thank you everyone for joining, and we hope to see you all in the future.
Thank you.